I'm Roger Demikowski from the United States. I'm very excited today to speak to you about a workshop that will be occurring in Maastricht, major pelvic surgery and pelvic radiation, urologic and colorectal outcomes, effects on the lower urinary tract, bowel function, and sexual function. We'll cover the diversity of presentations and the difficulties in management of this very particularly challenging group of patients. This is not only a reconstructive challenge, it's a challenge in terms of long-term patient management, the awareness and transparency with patients, pre-intervention of what we can and can't accomplish, and the long-term support for rehabilitation and chronic disease management. Many of these patients have undergone not only external beam radiotherapy, but also have undergone interstitial therapy, and the combination associated with often chemotherapeutic demands placed on, especially when we discuss conditions such as colorectal carcinomas, become very complicated in terms of management. And the considerations include not only all of the surgical preparation considerations and the patient preparation considerations, but also the perioperative management of these patients. And it's becoming quite clear that optimization of perioperative management is critical, inclusive of preparation of the patient for any planned intervention, large or small. So we look forward to presenting to you our combined experience, which presents over almost 100 years of urologic experience. I hope to see you there. Thank you so much.